Go.
Good morning, everyone. How's everybody doing today?
Great.
Excellent.
Good. Hot weather. It's here to stay. Just get used to it. Stop complaining about it. Get all your complaining done right now. Everybody go. Ugh. We're all done. No more complaining. All right. Well, good morning and welcome to this month's edition of Coffee and Conversation, brought to you by our Government Affairs Committee. My name is Jeanette, and I'm the president of the Chamber of Commerce here on South Padre Island. We want to thank Padre Brewing, Padre Island Brewing, for hosting us today. Lori is doing triple duty because Mark and Jose are on vacation. Thank you, Lori. Came in extra early for us. We'd also like to thank Karla Scimeca from Karla's Katering for the pastries. If you haven't had them, they're delicious. Here. Thank you. Round of applause. Great. So I want to recognize a couple of dignitaries that are with us today. We have City Council member Lisa Graves, who is also on our board of the Chamber. Thank you. And City Manager Randy Smith back in the back. Thank you all for being here. So we have some upcoming events that I'd like to mention. We do have a ribbon cutting this the 21st, Tuesday, for Remax Elite, their new location that is close by over here by Jake's. That's at 5:30 on Tuesday. And if you have not been to our new location at 4113 Padre Boulevard, please stop by and take the tour, see what we have to offer. And if you are not a member and you have questions about being a member, you can talk with Beverly Ybarra. She's right there, or you can stop by and see us at the office. One of the new benefits that we have at our new location, if you don't know already, is that we have 2 meeting rooms that you can rent. One that's a little bit bigger, seats up to about 20, and then a learning center which seats about 12 around the table. And you can rent those by the hour. We have special rates for members and future members. So if you want to stop by and check them out, check them out. All right, enough of that, and let's get on with who we have visiting with us today. We have a great team from Harlingen Medical Center. We have the CEO, Candi Constantine-Castillo. We also have Regional Director of Business Development and Marketing, Kathleen Avila. And we also have Natasha sitting at the table with her goodies, who is the Public Relations Director. I understand that they have some very interesting news to share with us today, so without further ado, I'll turn it over to Kathleen.
Good morning. How are you guys today? Thank you so much for taking right in front of the camera. Thank you so much for having us this morning, the Chamber. City Manager, thank you so much for supporting this initiative. My name is Kathleen Avila. I'm the Regional Business Development Director for Prime Healthcare. As you know, or if you don't know, Prime Healthcare has 46 hospitals across the U.S. In Texas, they have 6, and in South Texas, we have 3 hospitals here. Mission Regional Medical Center, Nat Medical Center, and as you know, the closest to you guys is Harlingen Medical Center. So we're so excited to be here on the island. I know that there's been a lot of buzz on what's going on, what's been building. We're right across the street from it. And so we're here today to just talk through introduce ourselves, number 1, know who we are. And number 2, answer and get your feedback on what you'd like to see on the island. And so I'm going to briefly just talk through what we currently have planned, and then I'll shift it over to our CEO, Candi Constantine-Castillo, and she'll go over kind of what the vision was and what's to come. So as you know, and I just want to, I know Dr. Ybarra, there you are, Dr. Joe Ybarra is our medical director for the clinic, and so I know he's been a strong voice to this community on health and wellness and trying to spearhead and bring some consistency to the island. And so we're proud to say that we're opening up the Family Wellness Clinic at SPI coming soon in the summer. And so I say that deserves a huge round of applause. So give it up for bringing this initiative, and it's been a lot of work. It's been a lot of organization and trying to figure out what we wanted to do here. We love the island. We have deep roots. Like I said, this facility is going to be affiliated to Harlingen Medical Center. And so starting off, we do want to start off with a family clinic. So it'll be open Monday through Friday, 8 to 5. We're hoping that it'll be open sometime in the summer, maybe early August. And so we will do a ribbon cutting. We will, inform the community. We've already been meeting with several organizations. We've met with Hilton. We've met with Holiday Inn, and just showcasing what our clinic's going to look like, what services we're going to offer. And so just a few things, and we'll pass out these rock cards so you have an idea of what's to come. So this is kind of our model. Our clinic is a haven for comprehensive care designed to cater to the unique needs of every member of your family. So we wanted to make sure that it wasn't going to just be internal med. It wasn't going to just be, it was going to be a family practice. It was going to be for everybody, from babies all the way to seniors. From preventative screenings and annual physicals to managing chronic conditions and providing specialized care, our team is experienced healthcare professional and is here to support you in every stage of life. So right now we're in the process of painting, renovating, making it beautiful. Like I mentioned, this clinic is going to be affiliated with Harlingen Medical Center and with Prime Healthcare, so we will have the resources for it to sustain itself, of course with the community support. And so that's just a brief overview of our clinic, and we're excited to be here finally. I wanted to just quickly shift off to some of the services we're going to start off with. So like I mentioned, annual exams, periodic health exams, Medicare wellness exams, preventative screenings, that's huge. We want to start with maybe skin testing. I know we see a lot of folks on the island that are locals or long-term residents, and we spend a lot of time in the sun. And so skin cancer is prevalent in South Texas. And so we want to start off with being ahead of the game, educating our community. And so that's one of our key focuses. We'll offer immunizations and vaccinations, diabetes management, that's another chronic condition that unfortunately is prevalent here in our community. Flu vaccines, high blood pressure checks, we'll manage chronic conditions as mentioned, minor injuries, lacerations, jellyfish sting bites, routine checkups, specialist referrals, and sports physicals. Going to the specialist referrals when, and I know Candi will talk through this a little bit more, but Harlingen Medical Center has several partnerships with cardiologists and orthopedic surgeons, and so this is just dipping our toe in the sand. We want to bring specialized care to the island, to the furthest part of Texas, and so with those resources, we'll have the ability to bring, ensuring that patients, residents don't have to cross the bridge for a higher level of care or for specialized care. We'll have in-office lab testing, so group A strep, flu testing, SARS, UAs, A1Cs. Those are the things that we're going to be testing as well. So that's just a little bit of the preventative side and the wellness screenings that we're going to offer. I'm going to shift it over to Candi so that she can talk through what the vision is and what's more to come.
Can you hear me okay?
Yes.
My name is way too long. Most everybody just calls me Candi, so I insist that you do. Thank you so much for taking time to spend with us this morning. And after 26 years of knowing Joey Ybarra, when he came to me and he said, "It's time," and I said, "Okay, let's go on this journey." It has been a lot of fun developing and designing what the services are going to be for the community. And as we open in the summer, we're going to start with an 8 to 5 model. But what I wanted to share with you all is we're going to let your volumes drive our hours. So if it turns out that 10 to 6 is a better time frame, 11 to 7, depending on the traffic and what your community needs, we're going to shift to make that happen. As we grow, we anticipate adding evening hours, weekend hours, and then the services will grow as well. But we're going to start conservative. We're going to start with a very finite and specific group of services. That way we make sure start, as Kathleen said, August-ish. We're in the process of recruiting. I'm being very, very selective in the recruitment. I want someone who's going to be committed to your community. I don't want someone who's going to be here 6 months, develop relationships, and off they go again. So we are being selective. We're vetting our candidates. We're getting quite a few individuals who are interested in the area, so that's exciting. I am a nurse by trade. I wear a CEO hat, but I started with Joe in 98 in Brownsville working as an ER nurse. So my passion is patients and patient care, and that's what I put forward first at our hospital. The rest comes if you give great care and with great quality. So that is our vision for the clinic. And I'm happy to entertain any questions that you might have. Please.
What about x-rays?
X-rays. At this moment, we are not going to have an x-ray machine, but I have heard that is a need. So we will have to continue to work on that, but we're not going to open with an x-ray machine. There are other options, mobile x-rays, etc. So that, in the interim, could be a possibility. Let's see how much we need. Maybe it's a day we bring someone over. When Kathleen mentioned the specialist, the vision is, the clinic has quite a bit of space, if anyone has been in there. The vision is to bring the specialist to the island. If the volume of need is 2 days a month or 1 day a month, whatever the case may be, we have cardiology partners, orthopedic partners, and our newest addition to our med group, which is part of this clinic, is an OBGYN, so women's care. So that'll be really nice for the women in the community. Please.
Are y'all going to have any kind of non-insurance?
Yes, we will have a cash rate package. That's a great question. And we also are going to be working with some of the employers that have individuals who may or may not have health insurance but need care, or maybe they have a slip or a fall or a strain at work. We'll be working with them to make sure they have adequate access to care as well. Yeah, that's super important, especially out here with the hotel industry. Yes?
Will you have physical therapy?
Physical therapy is not planned at this time, but again, the community is going to drive the need, and we're going to partner with you as we notice, okay, you know what, this is something we really should provide. We are wide open to looking at that. We're going to build this around the community, not just drop a doc in a box and only offer a few services. We're really going to try to blend it into your community. Other questions?
What insurances will you be taking at this clinic?
Oh my goodness, the list is very long. All major, yeah.
I would say Blue Cross Blue Shield, Medicare, of course, and better. So any of the insurances that our hospital takes, which are pretty much all of them, except for a couple of the marketplace plans, but Humana, all the major insurances. And of course, we're developing that cash rate package for those employees that don't have insurance that are affordable as well.
Great question.
But Medicare is one of
Oh,
them,
Medicare,
or
absolutely.
okay.
Medicaid, absolutely. Other questions? Joe, you want to say a couple words?
Yes. I have goosebumps right now because, this is like awesome. I mean, I actually lived on the island since 1994, and I met Candi soon after that. And so, as you guys know, I'm a local, I'm the EMS medical director, and what I love about Harlingen Medical Center is initially when we opened, we still have this tagline, but the tagline was, "We treat you like family." Okay? So I love that, and I think if that's not the tagline, it's still what they do. I know because I have kids. My kids have been born there. In fact, I have a 19-month-old. I have 24 kids. So, everything starts with a vision, and then you hope to align with that vision, and you want to participate with other entities that have the same vision. My personal vision is to optimize the lives of the people I love. Okay, I love this island. I love the people on the island, and so if I can be part of optimizing their life from a medical standpoint, then I'm aligning with my vision, and this is absolutely what Harlingen Medical Center does. My second vision mission is to affect healthcare in a positive way. And the way that I've seen that happen is through population health. So when we open this clinic again, because it used to be that Baptist clinic for several iterations, I wanted to treat the whole island as a family. Then the pandemic hit. And fortunately, because of the U.S. medical director, we were still able to take care of patients and transport them to the hospital. Unfortunately, there was no beds in the ER or in the ICU. So many of the paramedics and I went to patients' homes, and we gave them monoclonal antibody infusions and kept them out of the 911 system. So I'm happy that we have done this all together. And healthcare of the island is a family affair. And I think Harlingen Medical Center coming. And thank you so much, Candi. We've had this conversation for a long time, and she made it happen. So just want to thank you. And I'm here for you guys. I'm not going away. I'm going to be the medical director, and I'm going to be advising, how we kind of provide services. And we've done this once before with another hospital system, and what I learned from that was that unless the city participates, unless the businesses participate, it doesn't work. So we have to all do this together. We have to have a little bit of a margin to have a mission, right? So, but it's always going to be patients over profits. I'm not going to tell you that for sure because Harlingen Medical Center, Candi's, the whole team is really focused on patient care. And for me, it's population health and taking care of the whole city. So we're all in this together, and I just want to thank God, the universe, Candi. I mean, I have goosebumps. I really do, because when a city can have an MRI for turtles, but not an X-ray for people, there has to be something done. So we do have an X-ray room. So that will probably come soon. But we have a whole X-ray. We've been doing that. Hector, my community board certified paramedic, and I have been going to patients' homes, and even though we haven't been open, we've still been seeing patients at their homes or calling their prescriptions and keeping everything sort of together. And that continues even before we open in the summer. My cell number is everywhere. Everybody has my cell number. They can call me, and Hector and I will work out whatever is necessary. And regarding EMS, when the paramedics call me, many times I will call the ER doctor ahead of time at Harlingen Medical Center, where I'm also on staff there, and say, hey, we have a patient coming. Can you get a bed ahead? This way, they get really personalized treatment. And the individuals that have an ER contract are very aware that we're doing this on an island, so we're going to treat everybody who goes through EMS to the Harlingen Medical Center like family and everything that we have to treatment. Okay? So, any questions to me? Director Jordan? Thank you very much.
All right, I'll entertain any final questions.
Candi, I do have one question that's come in on the live feed. Will you have a doctor on site?
We will start with a nurse practitioner, and that individual will have immediate access to his or her medical director, which is Dr. Ybarra. He is local. If need be, we can always engage him, but it will be a mid-level provider, yes.
Thank you.
You're welcome. All right, I'll pass the baton.
Yes, thank you so much. Thank you. No more questions? It's so comforting to know that they're working on this for our health. So it's our responsibility is just to give them the support so that we can support them, they support us. So great information. Thank you all so much for sharing that. I think it puts everybody at a little bit of an ease in knowing what is actually happening. So, thank you all for being here today. I did want to mention one thing for you to put on your calendars, is that our 43rd Ladies Kingfish Tournament. This is the first all-ladies fishing tournament in the state of Texas. So it is going to be August 9th through 11th, and there are several ways to participate in the ways of sponsorships, raffle donations, angler registration. So if you have any female friends that like to fish, which I'm sure we do, we have some in this room, be sure to check it out online. You can give us a call, you can come visit us, you can ask us here today. But so that's our next big thing happening for the chamber. So thank you all again for being here. Thank you everybody from Harlingen Medical Center, and I hope everyone has a great day.